7 signs and symptoms that your heart might not well. What are the 7 signs you should be aware that they may be showing us that you have a heart problem, which it's the signs that you can see. 7th sign, Frank sign. From today, you will start to look to people's ears more carefully. I'm sure about that because there is a little sign in the ear that can indicate that the person has some blockage in the arteries of the heart, in the coronary or in the carotid. Back in the 70s, Dr. Sanders Frank noticed that many of his patients who had angina chest pain had a diagonal crease in the ear, and he described that sign as Frank's sign. What is the connection between heart and ear? One theory is that the same factors that damage the intima of the arteries can also cause this crease in the ear. Does everyone who has this Frank sign have a blockage? No. Among 100 people who have this diagonal crease in the ear, 30 have nothing, being just an age mark, but 70 has it, and the younger the person, the more likely it is to be a sign of coronary obstruction or carotid. So if the person is 40 years old and has Frank sign, we have to be more attentive than an 80-year-old, which is probably just because of age, and the sensitivity of this signal is low. That is, out of 100 people who have obstructions, heart disease, only 40 will have this sign. So you can't celebrate if your ear is flat. 6th sign, loss of hair on the legs. Loss of hair, first on your shins, and then on your thighs, could be a sign that you have peripheral artery disease, that is, blockage in the arteries of the legs. And since atherosclerosis is not a localized disease, but a diffuse one, if you have 1. blockage in the arteries of the legs, could be that you have blockages and other arteries in the body, including the coronary arteries, which supply your heart. Most people who have peripheral artery disease are only aware that there is something wrong when atherosclerosis is advanced. And why do they lose hair? Because hair follicles need nutrients to their fur to grow, so they need good circulation. If your arteries are clogged by the accumulation of fatty plaques, blood will not reach an adequate oxygen. In addition to losing hair on the legs, the person may have a smoother and brighter skin, cool skin, and decreased nail growth. But let me point out that also loss of leg hair can happen for other reasons, not just because of peripheral artery disease, as genetics can also lose hair for rubbing against your pants. 5th signs, xanthelasma. You must have looked into someone's eyes and noticed a yellow plaque on the eyelid. So this is called xanthelasma. It doesn't hurt, it's usually just a cosmetic problem, but it grows slowly. Xanthelasmas are the most common type of xanthemas, which are deposits of cholesterol in the skin. It is more common in middle-aged women and is mainly located in the inner corner of the eye, most often on the upper eyelid. About 50% of patients who develop xanthelasma have dyslipidemia or cholesterol high or high triglycerides. And look how interesting, only 1% of people with high cholesterol have xanthelasma. But researchers have found that having xanthelasmas increases the risk of having heart disease, heart attack, and stroke. So if you have xanthelasma, you have to do a blood test and measure cholesterol and triglycerides to ensure they are not high. 4th sign, arch or senile halo. As the name implies, it has to do with a G. It is more common in older patients. It is caused by cholesterol deposits at the edge of the cornea and looks white or gray, which is visible above and below the outer part of the cornea. In some people, this halo can take over the iris, the colored part of the eye. You can notice that before you had a dark eye and now it's getting lighter. The senile arch, it does not affect vision and does not need treatment. But there is a caveat: if the senile halo occurs in younger people before age 45, may be signaling that the person has severe dyslipidemia, i.e. high cholesterol or very high triglycerides. In this case, it is associated with an increased risk of disease, cardiac. If you are elderly and have senile arch, it is normal. About 60% of people over 60 years have it, and after the age of 80 it is almost 100%. So don't worry if you're over 60 years old and look in the mirror and find the senile arch. 3rd sign, cyanosis. Cyanosis is that bluish coloration or bruised on the skin. Could it be that it's too cold and it's purple? But it could also be saying that you have a heart or lung problem. If an area of your skin appears blue, cyanotic, or purplish when you are hot, This could be a sign that this part of your body is not getting blood oxygenated, which is read sufficiently. It could be that an artery is clogged. Now if the person is complaining of shortness of breath, it could be a lung problem, a pneumonia, an emphysema, pulmonary embolism, or heart failure, when the heart cannot pump enough oxygenated blood. Of course, other causes also fit here. Heart conditions such as birth defects such as tetralogy of Fallot, which causes cyanosis. Second sign? Ulcers. Those sores that don't heal on your legs or feet could be indicating poor circulation. It may be due to arterial insufficiency due to some obstruction in the artery that irrigates that area. And usually people won't be able to walk far or fast due to the legs become more tired and sore, or even have cramps. Most of the time these ulcers are painful, but if you have a nerve problem, such as diabetic neuropathy, you may not feel pain. And arterial ulcers, usually they appear on the outside of the leg and on the heels, toes, and usually do not bleed. The other ulcers are venous, which are the most common, and have to do with varicose veins or venous thrombosis. Unlike arterial, they affect the inner part of the leg and usually bleed. First sign? Swelling in the legs, ankles, and feet. This swelling or edema in the legs and ankles can be caused by a weak heart or swollen that can cause fluid to accumulate in the body. You may feel that your shoes no longer fit a tighter shoe. The ankle becomes fluffy, looking like that bread that is baking. When you press it does that dimple, what we call a locker sign. You are more likely to notice the swelling in your legs and ankles later in the day, because gravity increases the pressure in the leg veins, and if you lie down and raise your legs, it also reduces swelling. What are the 7 symptoms that you are experiencing that you may have a problem with your heart? The first symptom you should be aware of is shortness of breath or dyspnea. Especially when you try hard, it's a disproportionate fatigue to efforts. You get more breathless with everything you do. It could be heart problem. Second symptom, persistent cough with white or pink phlegm, meaning they have fluid in their lungs and their alveoli. It's important you don't let that cough go. Look for a doctor. Third symptom, shortness of breath. When you go to bed, the person starts to put more pillows to see if you sleep better, and over time she cannot lie down. She has to sleep in a chair. You can also wake up suffocated during the night, which we call paroxysmal nocturnal dyspnea. This speaks volumes in favor of a heart problem. Fourth symptom, generalized weakness, feeling tired all the time, and difficulty in everyday activities such as shopping, climbing stairs, carrying groceries, or walking. This is because the heart cannot pump enough blood to meet its needs of the muscles and tissues of the body. Fifth symptom, nocturia. When you sleep, you have to wake up many times at night to pee. This is called nocturia. There are many causes, but if the heart is not pumping properly, and at night this excess liquid needs to be eliminated. Sixth symptom, intermittent claudication. When you walk a few meters you feel pain in the calf of the leg. It's not pain time is when you make an effort, and when you stop it gets better. This symptom means that the blood is not getting there the way it should. When you stop it gets better. When you walk it hurts again. Seventh symptom, chest pain. If you are having chest pain, the first thing you have to think is a heart problem. You may not think it's muscle, gas, or anything simpler, but you always have to exclude the most serious thing. Heart pain is chest pain or discomfort that lasts for more than a few minutes. It can come and go. It can be like pressure, heaviness, a tightness, or burning. It can radiate to the left arm, to the neck, to the back, to the jaw and the stomach, both elbows, and may or may not have sweating, pallor, nausea, and dizziness associated. If you have these symptoms, you should see a doctor as soon as possible. And now, how to prevent you from having a heart problem. Do physical exercises. Get out of the chair. Do not stop. Physical activity is very important for your circulation, for your heart, for your mental well-being. Low-impact exercises such as walking, cycling, swimming may further improve flow caused by chronic obstructions in veins and arteries. If you smoke, stop smoking. Smoking is one of the worst things you can do for your health. Smoking causes impotence, inflames all your arteries, and forms fatty plaques, increasing the chance of heart attack, stroke, and dementia. If you are overweight or obese, lose weight. Excess weight raises your blood pressure, worsens blood sugar, inflames, overloads the heart, kidneys, joints, and venous system, increasing the risk of thrombosis. In addition to increasing fat in the liver, eat healthy things, lots of fruits and vegetables, fiber, whole grains, olive oil, and little red meat and processed foods. If you have a family history, especially a parent or sibling who has a heart condition, heart attack, stroke, stent, had heart surgery, you must be more attentive than the others people. If many people in your family suffer from heart problems, you have to do war and death examinations. Take care of your cholesterol and triglycerides. Eat more oats. Cut trans fats and fats, saturated fat. Lose weight. Eat more fiber, exercise, and even doing everything right to reduce it. Don't be upset if your doctor prescribed medicine. 80% of cholesterol is made by the liver. Even doing everything, sure, sometimes it's not enough. Keep your glucose under control if you are diabetic or pre-diabetic. Controlling your glucose levels well reduces complications. Glycated HB has to be below from 7. And finally, control your blood pressure. Your goal is to maintain a lower blood pressure at 120/80. For some, the goal might be less aggressive, like not being greater than 140/90. And of course, if you think you have a heart problem, if you've seen a lot of signs, and you have some of those symptoms I just mentioned, go to a doctor, explain it to him, and follow his guidelines. Did you like the video? Remember to subscribe, like, and share. Thank you so much for viewing my video today. As usual, I send you my best wishes for good health, prosperity, and happiness.